Well, is this progress? Because GOP Senators Bill Cassidy and Lindsey Graham propose a new health reform bill. They say they are close to getting 50 votes for it in the Senate. Come on in, please. Alex Azar, who knows a thing or two about health reform and healthcare generally. Alex, as I understand it, this proposal is as follows. Block Obamacare subsidies, repeal individual and employer mandates, repeal the medical device tax, and give block grants for Medicare to the states. Medicaid block grants to the states. Now, that's a rough outline of this thing. Do you think it's got a shot at getting 50 votes? What do you say?
Well, Stuart, it's a rapidly changing situation. So I'm about to give a speech, and yesterday morning I had a speech that said that reconciliation, that the last gasp of reconciliation was Cassidy Graham. Last night, as I was talking to people here in Washington, I think they've got close to 48 votes and are very close. I think John McCain very well may get on board because Governor Ducey of Arizona has come out strongly in favor of this bill. And, of course, Lindsey Graham is McCain's best friend. And Rand Paul seems pretty firm against. Sue Collins, I don't think, is ever going to vote for repeal and replace. That means the senator from Alaska, Lisa Murkowski, is where the action, I believe, is right now. I think there are probably two tickets to getting her support, if you can. One of them is going to be they're probably going to have to throw overboard the one-year prohibition on funding for Planned Parenthood. The other, there'll probably be a little provision in that says something oblique like for any state that has a state capital you can only get to by airplanes or by boat, there is hereby appropriated $500 million in stabilization funds.
So what you're saying is that they are very, very close. A little tweaking might do the trick. And you think they could get 50 votes, which means it would pass in the Senate. Would it then go to the House, and what would the House do with it, you think? By the way, as we're speaking, we're looking at insurer stocks, hospital stocks, medical stocks generally, all of them down, perhaps because this particular compromise looks a likely deal. So what would happen if it goes to the Senate, to the House, rather?
Well, I think the House members are going to be in a bit of a box, especially House members from blue states, California, New York, New Jersey, that have gotten Medicaid expansions and have generally high Medicaid expenses, because that money is going to go to non-expansion states. It's going to be reduced. But at the end of the day, I do not see how the Republican House of Representatives does not pass a piece of legislation that fundamentally changes Obamacare from being an individual entitlement to a state block grant program and controls the rate of growth of Medicaid into the future. Now, is this a conservative's dream? No, it's not, but it is not Obamacare.
That's the big deal, isn't it? Controlling Medicaid in the future. That's the big deal here. Do that, and you've really changed Obamacare. Alex, I'm sorry I cut it so short, but that really is good and vital information. Thanks for joining us, sir. Always appreciate it.